Hello, fellow carnivores. I want to go over today quickly the difference between a coronary calcium and a coronary CTA, or a coronary CT angiogram as it's called. Just to explain the quick difference for those who don't know what the difference is, this is a CT scan cross-sectional through the heart. And this is how a coronary calcium score is performed. A CT non-contrast is done through the heart, and then you follow the coronary arteries and you find areas of calcifications. The radiologist or cardiologist interpreting the examination will circle these areas of calcification and scroll through the entire heart, circle all the calcifications, and then the software spits out a coronary calcium number. So this is a normal heart, coronary arteries here. Here's a coronary artery and another branch here. And this is clean, no coronary calcium here. So if you go through the entire arteries and the entire heart looks like that, that would be a score of 0. That's what you want. And then here is a person with a lot of calcifications on this coronary arteries, and this person would have a high score on the coronary calcium. Now this doesn't tell you anything about soft plaque, and the ones I've read of these, usually when they have this much calcium, they're either usually smokers or diabetics, because both those are the highest risk factor for coronary plaque. And in diabetics, I see all their vessels in their entire bodies just full of calcium. You can even see it on an x-ray, like an x-ray of a foot. You can see that their arteries are just full of calcifications. So this happens throughout the entire body. Now, what about a coronary CT angiogram would look like this. So it gives you fancy images of the coronary arteries, and there's contrast in it. So this, you'd actually have to get IV contrast, and then you'd get a CT scan of the heart, and this is much higher radiation than a coronary calcium score, but it tells you about soft plaque. So here's a nice normal coronary artery. This has minimal, here's a little tiny calcification here. This one has a little bit of soft plaque here, and here is a mild, this one 50 to 69% stenosis. This is a soft plaque here, that would be moderate. And then severe here, there's soft plaque on this side and soft plaque on this side, greater than 70%. This is a severe stenosis. So this gives you more information about your coronary arteries. And see how here there's no calcifications like this. Here there's low calcification, but here you can have severe narrowing from a soft plaque even though there's no calcifications seen here. So this is the best examination to get. It just, the downsides is that it's expensive. You have to get IV contrast, and you have to get a lot more radiation to get this examination. So let's talk about the risk factors for coronary calcium. Let's look at this JAMA study in 28,000 women, looking at the hazard ratios for risk factors for coronary heart disease. Here's the table here. And typically, hazard ratio less than 2 is considered noise. So that's where we see LDL and total cholesterol, very low hazard ratios. But what are the ones above 2 that are the highest? Here we have currents, we have diabetes, smoking. Let's look at this in a simpler pie chart here. So if you take those hazard ratios, put it in a pie chart, you see type 2 diabetes, metabolic syndrome is the great majority of the risk factor for coronary heart disease. And then you got hypertension, obesity, smoking, triglycerides, overweight, and then LDL is this little tiny one, and then high CRP and inactivity. So what you should really be worried about, more than half, yeah, you can quit smoking, but more than half, if you look at type 2 diabetes, metabolic syndrome, hypertension, and obesity, that's where your risk is coming in. And that can all of this can be fixed with the carnivore diet. You can reverse your type 2 diabetes. That will also reverse your metabolic syndrome. And I haven't seen anyone yet not drop their blood pressure going on a carnivore diet. By eliminating carbs, you're lowering your insulin, you're flushing out sodium, and you're lowering your blood pressure. And then everyone knows about the weight loss benefits of carnivore diet. So there you go. There's the biggest effects you can have on your health by eliminating these risk factors and not worrying about the small, tiny LDL risk factor. Because what happens when you get type 2 diabetes and metabolic syndrome and hypertension? The sugars are glycating your tissues, your blood vessels. The hypertension is causing stress in the vessels. That's what's causing endothelial damage. And then there is cardiologist out there, Nadir Ali, that believes LDL, when the damage is caused by the blood sugar and the high blood pressure, LDL comes as the firefighter to heal the endothelial damage. So they say, when they first looked at the coronaries and saw plaque and said, oh, there's LDL in here. But is it there because there's a fire to be put out and the firefighters come, or is it there causing the problem? And it seems like it's actually there to help. And we see in the recent lean mass hyperresponder study where average LDL was over 250 for 5 years, most of them had zero coronary plaque. Even someone with the LDL in the 400s had zero plaque. And then when they compared them to the Miami Heart study of normal patients with normal LDL, they were identical, but actually it was downtrending to actually, it wasn't statistically significant, but it was downtrending that the people with the higher LDL were downtrending to have less plaque than people with normal LDL. So just things to think about there. Biggest risk factors there. And it's really like, why would you want to take a medication to lower your LDL when that medication side effect causes insulin resistance and type 2 diabetes? 50% increased risk if you're taking a medication to lower your LDL, 50% increased risk to get type 2 diabetes. Now, that's a relative risk, I'll admit that, because the studies will try to fool you by saying, oh, it's reducing your cardiovascular risk by 50%, 40%, but it's only increasing your risk of type 2 diabetes by 1.5%, because then they'll use the absolute risk for the risk factors and try to fool you by using the relative risk for the benefit and absolute risk for the risk factors. Also, now that we know Alzheimer's is probably type 3 dementia, those medications make sense that they cause dementia because they cause insulin resistance. The other side effects, muscle pains, and even there's no benefit to all-cause mortality in those studies because the patients that are taking the slow toxic poison over many years end up getting more cancer and dying from other things. So even though there's a reduction in cardiovascular events in those studies from taking that medication, the all-cause mortality is not changed. And now that they're finding that most people have no benefit from taking a cholesterol-lowering medication, now they're trying to change the story from LDL to ApoB because they need something else to target so they can sell you a medication. So the story goes on and on. It's just another trick that they're trying to do. They're trying to pull over everyone. So don't fall for that and take your heart health in your own hands. And, the best experiments is the N of 1, right? So, yeah, we can wait for the lean mass hyperresponder second 1-year follow-up data to come out this summer from Dave Feldman, and to see if those people had increased or decreased level of plaque after 1 year. But what if you have your own coronary CT angiogram and you track it in a year and see if it goes up or if it goes down, or if it goes down or stays the same? Then you're doing the right thing. Because that study is limited to like the types of people are in it, A lot of those people are potentially keto and not carnivore. You don't know what they're eating, what they're doing exactly, what their lifestyle is like. But if you have your own CT coronary angiogram, coronary CT angiogram, and your plaque is staying the same or going down, you know you're doing the right thing. If it's going up, maybe you have to change something. And that's honestly the best way to go forward for your health. If you're concerned because you have high LDL and your doctor's freaking out, you can get an imaging study, a coronary calcium, which is cheaper. It's like $50 without insurance. Or the more detailed, high-level examination is this coronary CT angiogram. So that's all today. And this is just I'm not making any money off this. This is a passion project for me. Just want to get the information out there. And let me know if you have any questions or want me to cover anything else. And I'll see you next time.